guys, welcome to this live. I am Carmen Woodland. I am an orofacial myofunctional therapist. I am also a newly minted nutrition therapy practitioner. So super excited to be here. A couple things, you guys might know us as Integrative Myofunctional Therapy, and we are currently rebranding to become Impact Myofunctional Therapy. And then, so you'll see those changes kind of coming through. We are here tonight to welcome the beautiful new human to my team, Jessica. So you're going to get to meet her momentarily. But a couple things first. I have some notes, so if you guys see me looking off over here, it's to make sure that I don't have any shiny squirrel moments. First, this is Jessica's first Instagram Live. I see that she has already joined us, so we should be good there. But it's technology, you guys, so if something happens, come back. Okay, if we get disconnected somehow, we will hop back on here and we'll start over. So we have that. Also, if you have questions, just because this is Jessica's first Instagram Live, I told her we won't be paying attention to questions and stuff that are coming in. We gave an opportunity on Instagram to ask questions previously. And so we won't be looking there, but remember, I will, we're recording it obviously, and then we'll go back and look. Okay, so unless I see something that we can answer, I definitely will. Okay, so I see that Jessica is in the house. I also see somebody else has asked to join. So let me see. I'm gonna get in and get comfortable. So we'll see if this works for her. So a little bit, you guys, about why I decided that it was time to bring on an associate. And that's just because, it's just because I am so proud of this company that I have grown, but it's been my baby. I have been the one who has done all of the therapy. You guys, it's been kind of like grape nuts. So as soon as I really started focusing less about just tongues, like just the tongue tie, or just putting a Band-Aid on a bullet wound, as soon as I really started working with my clients on wellness and getting better, not just fixing a symptom, but looking for the root cause, it has really grown. So that's why it was time to bring her on. So before I let her introduce herself, I'm going to brag on her for a minute. So I trained her. So Jessica she was a blank slate when I got a hold of her. So I've trained her from the ground up. She has been nurtured and mentored and trained exactly how I would have somebody else do it. So it only made sense that she be the next person that I bring on board. So when push came to shove and I knew that it was time to do that, I knew that she was going to be the great fit. So before we jump in, the last thing I am going to say, you guys, I alluded to this on the social media when we started, or when I was advertising, that I'm going to do some giveaways at the end. So if you stay till the end, we will go over that. So, Jess.
Hi, can you hear me? Is everything working?
You're good. You're good. So you're doing your first Instagram Live. Yay. I did see some other people with the same last name as you.
Yay. I'm not even looking down there. So yeah. I'm just focused on task at hand.
Don't even worry about it. But I saw you have a fan club join. So the first thing, if you will just introduce everybody a little bit about yourself, and then we'll just kind of go on. I told them that that we have a list, and that, hey mom. Your number one fan. I told them that we have a list of things that we're going to go over so that we don't have a shiny squirrel moment. And then we'll go from there. So tell us who you are.
Awesome. So I'm Jessica, as Carmen has introduced me already. I have been a dental hygienist for about 14 years now. So I have worked in the private sector for quite a long time. I've also worked for the United States Air Force for a few years as a civilian, and then I have taught at the local community college, dental hygiene community college. And so I have had a lot of experiences in a lot of different areas. I've also temped in a ton of different offices just on my days off or in between jobs. So I've experienced a lot of different things in a lot of offices. I have 3 kids. I think one's on
one
here.
of which is here.
Yeah. And then, and I have been married to my husband for about 22 years. So that's a little bit about me.
Awesome. What led you to Myo? Like, what led you to, not your why, not why do you want to do this or why you're passionate about it, but what led you to decide, hey, I want to get trained in this? Where, like, were you at a conference, or how did you find out? How did you know?
So while working at the Air Force, I saw a lot of like 18 to 20-year-old men and women who were on CPAP machines, and they were fit, and they were not your typical, what I was trained of people that have sleep apnea. And so I wanted to make a difference. And I started to recall all my experiences in different private practices and all the different times I've been a hygienist and cleaned teeth, and just noticed that there's something more that we can do, that we don't just clean teeth. We can do so much more and find so much more and help people. So that's what led me to do my own.
Awesome. And then how did you know that kids' airway and sleep were going to be your passion? Because I don't think you started there, did you?
No, I have a daughter that has some sleep issues, and I was really concerned, as any mom would be, looking for a bunch of answers and looking what can I do. And I've asked a bunch of different providers, and I just wasn't getting the answer that maybe I wanted or that I was looking for. And I knew that there was something that was more healthy for her in a different way. And so that is kind of what started the ball rolling to be this is what I wanted to, this is the population I really want to focus on. And so I love working with kids. I have my whole career worked with kids. I love my own kids. And so it's awesome that's kind of where my area has been.
Now, what did you find now that you have taken this huge cannonball into the pediatric sleep community like you have done? What is different from you as a professional who, as an expert in the field, to what you were being told as a mom? Because we're going to have some mom questions here in a minute, but that's huge. I know that's wildly different for you. So what kind of things are different?
Absolutely. So one thing that I learned that I had to do was ask questions. So keep asking questions. And if you don't understand, keep asking questions, or ask different providers, or not necessarily until you hear what you want to hear, but you need to ask questions to find out the why behind everything and the reason for everything. I think that's super important.
Absolutely. And I like how you said not to hear what you want, because as we teach our people, they're not always going to hear. Well, we hope they don't hear what they want to hear, because oftentimes you and I come with a very unpopular opinion. And I don't mean an incorrect opinion, you guys. I mean an unpopular opinion, meaning parents have trusted, and we put these doctors on a pedestal, and we bow down to them like, hey, this is what they said. But it's very different. You have to ask questions. And it's interesting. I'm glad you said that, because I was literally just working on, we're recording, our blog videos tomorrow. And one of the ones that I have coming up in February is that parents are going to be the change. And what I mean by that is, when doctors get tired of listening to pissed off moms say, why is this going on? Why is my kid peeing the bed all of a sudden? Why is my kid grinding his teeth all night? Why is my kid being medicated for ADHD? Like all of these things, it's going to be the parents that force the change. And I wholeheartedly believe that. So I'm glad you said that. So, all right. If it's okay with you, we're going to put you in the hot seat. Okay.
All right.
So I hope you put your deodorant on for this.
Let's go.
So I know you're new to my community. I have been telling people about you for several weeks. I have done exams on lots and lots of people since we made this decision to move forward, bringing you on as my associate. And I keep telling people that if they love me, they're going to love you. And so that means if they hate me, you're screwed, Yeah. But so you're new to some of these people, but I think that you will really have a connection with them, because you're a mom, and you're a mom who has been just so frustrated with what's going on and what's being said out there in the community. And, you know, mamas, we will claw through chain link to get what we need for our kids. We will gnaw through it. We will chew through it. So I think that the reason that you're going to connect with my community is that because you're a mom. I'm a mom, and we want to protect our babies. So I have some questions that we're going to kind of talk about, not so much necessarily just to put you in the hot seat, but to have a conversation back and forth. So I chose these questions from the standpoint of what would you have done differently as a parent if you had known some of this stuff? Because again, our hardest population is to educate is the parents with kiddos, because this is new to them. Like you and I come out of the gate saying, hey, here's why your kid's face is looking like this, and here's why this, and here's why this. And sometimes parents are like this because they've never heard it. And it's a little bit alarming. So let's just jump in, okay? So let's talk about baby food pouches. Let's talk about kiddos drinking their meals. What do you say about that? What kind of impact is that having on them?
So to start off with, I did everything wrong. And so if there's somebody out there, please do not beat yourself up. I was doing everything that like I knew how before. So I was a mom of convenience and quickness. If it was convenient and it was quick, I was shoving chicken nuggets and applesauce pouches to my kids, that's what I was feeding to my kids when we were in a hurry. And I have learned so much that we have to stimulate those muscles surrounding the jaw, around the jaw, in order for our children their faces to develop correctly, and in order to make an impact on those that muscles in their face. And so my recommendation, if I can tell anybody to do it the way I didn't do it, definitely you can still give applesauce pouches. That's not a problem, but just not as frequently, and be very careful. Make sure you're giving your kids lots of textures, harder, chewier things to eat that really makes those jaws work in order to strengthen those areas, and then their faces will have a better chance at developing properly.
Absolutely. In addition, nasal breathing. Nasal breathing puts an expansive force on the face, and that helps as well. So this is also an area that I talk a lot with parents about, the work of Dr. Weston Price. So just to give the Reader's Digest version for you parents watching this, Dr. Weston Price was a dentist who really, what he did was study indigenous populations across the world, because he was trying to figure out why they didn't have any decay in these very, very poor countries, why they didn't have any decay, why they had beautiful arches. You can go back and you can just Google the research of Dr. Weston Price and see that here these populations, they were very, very poor, but they had these beautiful arches, room for every tooth. It's not a thing to just pull wisdom teeth just because, or as just in case. And so that's one of the biggest things is those populations ate their native diet. They ate food that they had to chew on. So our faces didn't start changing until the sad American diet came about. So those soft foods. So I like just how you say, like, don't beat yourself up. We all did that. Like, I didn't know any better. And so as parents, if we can have our kiddos chew their food, breathe through their nose, chew is the biggest thing. And that's what I tell parents when they reach out to me asking about, you know, an 18-month-old or a 2-year-old. Okay, so that was awesome. Big impact on facial development. And ultimately, we want facial development so we can have the development of the airway and a good-looking kid. Okay. Okay. What would you say as a parent, knowing what you know now, or what would you say to parents knowing what you know now about you're fine when it comes to a tongue tie? Your kid's fine.
So I would definitely say don't blow this one off for sure. We really want to evaluate, and the younger the better. So if we have infants, let's start looking under the tongue. Let's see if there's any ties anywhere around the lips, anywhere that could have long-term effects on our children. And so the sooner that we can find out and that we can discover that and get help for that, the better. And I would say, again, if someone says, oh, don't worry, that doesn't need to be released, get a second opinion. If you feel that it's necessary, please reach out to a community member that is like-minded to you. And that's one thing I've learned a lot from Carmen is there are people that think the way that we do, and there's people that don't think the way that we do. And it is very important that if it's important to you as a mom and as a dad, a grandma, grandpa, aunt, and uncle, whatever, that if it's important to you, it needs to be, you need to get the answers to your questions. And tongue ties is definitely one of those things that can have lasting effects on us.
Mm-hmm. Yeah, that facial development. So for those of you guys that have been with me for years, you know that the impact this is to the facial development. If the tongue is tied down and it's low, it can't be in the roof of the mouth. So if it can't be in the roof of the mouth, it can't be spreading that maxilla, which in turn shapes the mandible. So the maxilla is kind of like a lid on the box. So it's the bigger part. The mandible comes up underneath it. And when the maxilla is not big enough and spread out enough, then the mandible can't as well. And then that means that we have a compromised airway, the tissues of the tongue, the tonsils, you know, that kind of stuff just kind of sits back in the airway. So it really matters. So when I have parents that say, so what, is this a big deal? Yeah, it is a big deal, because the long-term consequences of ignoring a tongue tie now are huge. So, and I think that is the hardest thing, is ask questions. If you know something's wrong, continue to ask questions, because the number of doctors who don't even look at tongue ties, who don't know anything about them. I just had a client who had a release today, and I did therapy with him this evening before we jumped on the call. His mama is a pediatrician and he's 13. And so she is like mind blown, and that happens a lot. So I've had lots of those situations. So if you don't have somebody who is open to answering your questions, find somebody else. Okay. Next, let me see what the next question is. I think I just want to add to that last one about the tongue ties. I just had notes. Don't follow blindly, ask questions, seek second opinions. Tongue ties are not a myth, you guys. Don't let the doctor roll their eyes at you or gaslight you. You're not crazy, and they must be addressed early. Okay. The next one, Jess, what would you say to parents? What do you know now about open mouth versus when you didn't know?
So just breathing out of your mouth and not nasal breathing. So you can't obviously breathe out of your nose and your mouth at the same time. So super important that we're focusing on making sure that mouth stays closed. If not, the development of our lower jaw, where our mouth is going to be open, exactly. Everything's going to hang long and low and back. And our main goal with myofunctional therapy and development and all of that is we want to go out really wide and we want to go forward, and we want our littles, that's the way we want their face to grow. And so if we're mouth breathing, or we have a tongue tie and our mouth is down, or we have low tongue posture, all of that will contribute to incorrect facial development.
Crowding, less room for the tongue. So all of those families that say, oh, Johnny has crowded teeth, he's got his daddy's teeth. It's like, no, why? Crowded teeth are why? Let's get to the bottom of it. That's the biggest thing. So, and I'm sure you and I will be out here in the future talking about airway ortho, because that's a whole nother ball of wax in itself. But that's what's so hard, is we don't want to just look at it like, oh, we'll fix it down the road. We want to fix it before it's a problem. So I've talked with my audience a lot about Dr. Bieneman, and he was speaking at a seminar I was in the other night, and he said his goal before he retires is that he doesn't have to treat another adult. And that's not that he doesn't love treating adults. He wants to fix the kids so that they don't become adults with issues. The other thing I just want to touch on, mouth breathing, what would have made a big difference for me as a parent had I known that with my kiddos, is the nervous system. So you've got parasympathetic, you've got sympathetic. Parasympathetic is your rest and digest. 99% of the population who works with my company, they breathe like this. they're mouth breathers and they're breathing like this. So this shallow thoracic breathing, you guys, is sympathetic overdrive. That is you running from a saber-toothed tiger all the time. And the nutrition therapist in me comes out and says, yeah, and this is why you have digestive issues, because your body doesn't care what's happening to your burrito when you're running from the saber-toothed tiger. So we have a lot of kiddos. I just started working with my youngest kiddo ever who is being medicated for anxiety and depression. You guys, she's 5. When you're in sympathetic mode, you're in freak out mode all the time. When we get kiddos nasal breathing, we can settle them down and balance their nervous system out. So that's definitely something to think about. I have many parents that have implemented timeouts as nasal breathing sessions. And I also have a family in Switzerland. They do belly breathing in school every day. So the kids learn how to belly breathe, which is a huge, huge thing. So, okay, I could go on and on and on. Next, what would you say to the parent who thinks that snoring is cute?
So snoring is not cute ever. And snoring is something that should always raise a red flag, whether it's a baby, whether it's an 85-year-old, whether it's your bed partner, whoever you need. Snoring should always raise a red flag. And I think it's super important that you get an evaluation. If there's the definition of snoring is audible breathing. And so if we're hearing anything, we need to be getting that checked, and then we need to follow through with treatment if treatment is advised.
Mm-hmm. That means if sleep apnea is diagnosed, you guys, you do something about it. So yes. Super duper important. So many people think that snoring is just annoying or it's a pain in the butt. We're not really diving into sleep apnea, as a topic, but I will tell you guys this: sleep apnea is the most expensive chronic degenerative disease there is. And if there's a passion at this practice that Jess and I both have, it's the sleep apnea. So that is our biggest why, which leads me to the last one. I didn't think we were going to talk about ortho, but we are briefly. So what would you say about conventional ortho? Let me back up. Conventional ortho, you guys, for those of you guys who don't know, is going to your regular Joe Blow orthodontist who says, come back when your kid's 13 and all the permanent teeth are in, and then we're just going to crank those puppies and get them straight, and we're going to have it look beautiful, paying no mind to the other habits, the low tongue, the tongue ties, the mouth breathing, all of that stuff. So that's really what we talk about when we talk about conventional ortho. So just to put you on the spot, Jess, what's the opposite of conventional ortho? This isn't on your sheet.
No, you're good. You're good. So finding an airway-centered orthodontist is the most important. And I was able to spend a full day with actually Dr. Bieneman in Colorado. And we went through all these cases, and he explained why we're doing this and why we would choose conventional, airway ortho or over conventional. And the reason is because they are concerned about the airway, number one. It's not that we're straightening teeth and making straight teeth pretty and sending you on your way. There's a much deeper connection. So we're looking at that airway. What can we do to expand, make more room back there, and just make us breathe better? And it has changed my own family's life, and I promise you it will change yours if you're looking for a difference, for sure.
Absolutely. I have shared a lot with my audience, my personal journey with my youngest daughter, Taylor, who has a beautiful smile. So Taylor had retractive ortho. So, you guys, we talked a lot about the face coming forward, why it's important for that. And my daughter, they pulled her back. So rather than taking the time to bring her forward, they pulled her back. So she has a beautiful smile. However, she has upper airway resistance. She has sleep apnea. She has nightmares all night. You can look at her sleep study where she'll sleep for a little bit. She sits straight up in bed. She has a nightmare. She's sweating. And then she has insomnia because basically the body says like, you just tried to kill me. And so I'm going to just go ahead and let's watch another episode of Grey's Anatomy because you just tried to kill me. And if we're awake, we're alive. So that's what she goes through every night. So she's 27. She feels like an absolute bag of pounded dog poop. She's got beautiful teeth. So she went to a conventional orthodontist. So that's the biggest thing. And I think, again, that's the hardest part for parents because it's expensive and it's time. And really, Jess, and I don't know if you and I'm sure we have talked about this, but I am really just starting to educate parents on quit worrying about paying for your kiddos' college. How about we just give them the structure so they can breathe, so that they have good mental health and motivation and sleep and good, feel great to actually go to school, and let them pay for it themselves. Let's let's help them build a house of foundation, or a foundation of health, and then let them worry about the college. But that's the thing, you guys, you don't get quality cheap, and that's hard for a lot of parents. I know that's really hard when an orthotropic orthodontist can be a $15,000 case and a conventional orthodontist is $5,000. So we call him a chief beautician for a reason. I am your classic person. You can look at my facial structure and see that I was a mouth breather. I was the world's biggest mouth breather. Nobody should have put braces on this face with me mouth breathing and taking 4 allergy pills a day. Not once, not twice, but almost 3 times. And that's the tricky thing. That's the hard thing. Jessica and I see these cases where they come to us, they get referred to us by an orthodontist who says, hey, fix the tongue thrust. I'm having trouble keeping teeth where I want them to be. And we're like, well, how about we fix the tongue thrust and the tongue tie and the mouth breathing? So a good airway focused orthodontist is going to work on what first, Jess?
Are you talking about the spot? Tongue on the spot?
No, airway. I caught you
off
guard.
Sorry, you were doing this and I was like,
yeah. No, so airway,
we got
first,
it.
You guys.
I'm tracking.
Airway trumps everything. And so when ortho cases come to us and the kid has been in ortho since 1st grade and now he's getting ready to graduate high school and has been in braces 3 times and had 2 sets of expansion and now has a tongue tie and mouth breathing, somebody really dropped the ball somewhere. That's the thing. And Jess and I will tell you guys this, you already know this about me, but you're going to learn it about her real quickly. We're not afraid to step on those toes. And that's not that we want to be unprofessional, but it is our job as your health guru to make sure that you know what you need to know. So, okay. All right. Jess, you're in Wisconsin right now. What are you doing there?
I am. If you haven't noticed my lovely surrounding background, I promise I'm not at home. Hey, so green. I have spent the entire week following a sleep medicine doctor around, a sleep medicine MD, and it has been phenomenal. I have been literally in her back pocket. We see about 22 patients every single day, and it has been incredible, like life-changing.
Did you say a sleep MD? So a doctor, not a dentist. Yeah. Oh, so yeah. How different is that from a dental sleep medicine person?
So she is learning about myo. She knows about myo, but hasn't really implemented it into her practice. And so I've been able to teach her my side of what we're capable of doing as a myofunctional therapist, and then how we can incorporate that into sleep medicine. So it's been pretty incredible, and how they work together with mild to moderate versus severe. We've seen a lot of severe cases. So
what does something really stand out? Does something give you the goosebumps from this week?
So there is a couple. We've seen anywhere from 6-year-olds to 90-year-olds. And there was this little 80-year-old lady. She came in on Monday and her color was horrible. And I literally thought she might just leave us while she was in the chair. And she was saying how she has just felt crummy for so long. We had a cancellation that night. We were able to get her right into the sleep center that night. We did a sleep study on her, and then this doctor in particular sees them first thing the next morning. So they have their sleep test, they run the reports, and then the sleep doctor reads them that morning. And she came in and she was a different color. Her entire persona had totally changed. She had almost a little skip in her step. And she was telling us how good she had felt, and they put oxygen on him halfway through the night. They do a split study. So the first part of the night, they just let him breathe and we watch what they do. And then the second half of the night, they stick oxygen on them, either like a CPAP, a BiPAP, or whatever they need to do and manipulate that. And she said she hadn't felt that good in years. She couldn't tell you the last time she felt that good. And then she looked at me and she said, and I think I even have a sparkle in my eye. And it just touched my heart, because this is something that this lady could have had how many years ago, and she's 80 something and just getting help for the first time. And so I think it's really, really, really important that we just step in as early as possible.
I got goosebumps listening to that story, and it reminds me of somebody a little bit younger, but she came to me recently with severe apnea. And once I did her exam and stuff, I just said, has anybody ever talked with you about airway ortho? And she kind of looked at me like, at my age, and nobody, so she's severe apnea. And of course it's obstructive. So again, a conversation for another day, but central apnea, you guys, occurs in the brain, and we're not fixing that magically. But in her case, nobody had ever talked with her about her severe crowding. I mean, teeth on top of teeth, lovely human. And she's so excited. Now she's in an expansion appliance. She's getting some space. And at the end of the day, sleep matters. So the person that you got to meet, it's huge. It's our motherboard, you guys. We need to quit accepting poor sleep as a badge of honor. Oh, I can get by on 5 hours. Well, you're probably going to be here with us 10 years or 20 years less. So we don't want that. Okay. So next, let me see what else here is on my list. So quickly, you guys, before we start to wrap up, I want to share with you guys what it's going to look like to work with Jess. We're getting a lot of questions now that my community is getting the option on their exams to work with me, work with her. So I will at this point do all the exams. I can't say forever, but right now that's my baby. So I do the exam. I offer a spot to the client in therapy with us at Impact. If the client is a good fit. A client is only a good fit for us if they want it worse than we want it for them. That means they want to tear off the Band-Aid and get to the root cause. If you come to us and you say, I only want to prepare for a tongue tie release, you're not our human, because we do complete wellness and rehabilitation. So that's the biggest thing. Got to be a good fit for us. The kits and the paperwork, all that stuff is handled here at the home office. I create the therapy templates. Jessica does them. So that's how it's going to be right now. That may change in the future, but for everybody that I'm handing off to Jess, I choose the therapy because I've done the exam. I decide what we have to do. She facilitates that. So she is just me, but she's forward facing to you guys. So she delivers it in accordance with the standards of my company, which is premium level. It's very high. We're not just crossing our T's and darting our I's. We're really working to get to the root cause of it. And then the other cool thing that we do is every 2 weeks we have a team collaboration meeting. So that's where Jess and I meet. We've got all of the cases that she's working on, and we talk them through. Not only just so she can have a different perspective, I want to know how everybody's doing. Does she have any snags? Are there any questions? All of that stuff. Because she's not going to be able to answer every single question, but guess what? We'll get the answer. And I know that she will get back to you on that. So that's what it's going to look like. I set up the therapy, I do the exam, she meets you for the sessions. You still have the option to work with me. I'm still here. We're just really reserving me to work with the worst cases, the most complex cases, and then also those clients who want to do nutrition therapy, because Jess can't do that. So last, Jess, I'm going to leave you with a couple of the frequently asked questions that we got when we got ready to go on live here, or that people have been asking via email. So the first one, I think that's obvious when somebody brings on an associate, is, Jessica, are you going to be cheaper? What do you say to that?
So a little bit, but again, you have to remember that we're establishing a premium level practice. And you don't go to Walmart to get like life-changing experiences. And so we have huge goals for you. Carmen sets goals, I set goals. We have some big goals for you. And so not really. I mean, not really.
Yep, that's great. And I love the Walmart example. Also, like you're not going to buy a pair of jeans that make your butt look really great on the end cap at Walmart. You're just not. You're going to go to a high-end boutique that has really great quality denim, and that's what you're going to get. So, great answer, Jess. Are you going to have more hours to offer?
So both Carmen and I will be working like a complementary schedule. The mission of the company is to make sure that we can reach all corners of the globe. So we will try to be as accommodating as possible. Now, if there is something that we tell you to go schedule and you aren't able to schedule for some reason and you need a particular day, please contact one of us. We will do our very best to make sure that we can fit you in where there's a spot or try to accommodate those needs for sure.
Absolutely. And another kind of build on that just a little bit. A lot of our clients are comprehensive wellness clients. So those are cases you work with us for a year. They have unlimited sessions. The huge difference there is that we get more work done, but we don't offer those unlimited sessions so that we're abused by texting us at the last minute that you're at the grocery store and can't make it. That's not going to work. So otherwise, we are accommodating. So I always tell clients, we don't expect you to see us before 6 a.m. or after, 7 or 8 p.m. in the evening, because we do work worldwide. I have clients that meet me in Hong Kong at, a late hour at night, but that works for them. But we're willing to be flexible with you guys as long as you don't abuse us. That's the biggest thing. If you make an appointment when we tell you to make it, you're going to get what you need. Okay, Jess, are you going to see adults too, or are you just going to focus on those kiddos that you're so passionate about?
Yes, I will be seeing adults as well, for sure. I'll see everybody. The only clients that I won't be seeing are those that are in the nutritional therapy program, and that's what Carmen will be seeing. I'm not trained for that, Carmen is. And so, yes, I'll be seeing anyone from 4 to 104. Yeah.
You will be, my oldest client so far has been 79, and we worked from 79 till she was 81. So, okay, so let's get ready to wrap up. There's a couple last things that I want to say here, you guys. So first, Jessica's going to be seeing clients in January. So remember, you have to have an exam with me to get through that gate. So if you met her here tonight and you just love her and want to work with her, I know some, Jess, like I told you, I know some coming here were. Make sure you're on the calendar to get an exam. I close the last 2 weeks of the year so I can enjoy the holidays. So if you can't find exam time, get on the books first thing in January, because Jessica's schedule is going to fill up quick. And then we're back at the same problem. There's not enough of us to go around. So plan ahead. Don't wait till the last minute. If you know you have myofunctional concerns, if you're mouth breathing, if your tongue is low, if you know you have a tongue tie, all of those things, now is the time to be thinking ahead. And then last, you guys, the giveaway. So I said, for those of you who are waiting here till the end with me, I'm going to give away comprehensive nutritional analysis. So that's a pretty big deal. If you in the comments type in, I love Impact Health Restoration. How do you like that for a plug? That is my nutrition company. Again, I love Impact Health Restoration. I just wanted to make sure to get that word on your guys' mind. Type it in. I will be going through those to see who comments, and I'm going to be giving away 3 of those. So what that will entail is doing a complete, like, all of your paperwork. Oh, somebody answered, I love Jess.
I love you.
Okay, that person is fired. We got to get, oh, Jen says, I love Impact Health Restoration. Okay, so we're getting some answers there. So when we do those comprehensive nutritional analysis things, you guys are going to be blown away. So I look forward to doing those with you guys. So I will be letting you know. I will send you a message so that we can get in contact via email. So again, I love Impact Health Restoration. Okay. Last, you guys, thank you for coming to join us, to give me a big hug, to give Jessica a big hug, to welcome her into the Impact family. Jess, I'm so excited to have you.
Thank you.
I think that it's just going to be incredible. So with that said, you guys, I'm going to let Jessica get ready for bed because she's got another big day in the sleep clinic tomorrow. The rest of you guys, I want you to go make an impact on somebody else's life right now. So I
Okay,
love you
thank
guys,
you.
and we'll be back soon.